Medical detox for drugs and alcohol is what addicts and alcoholics fear the most at the end of their addiction and beginning of their recovery. How do we overcome this fear? And what is the process of medical detox for someone seeking addiction treatment? This video will answer these questions and a lot more about what to expect from a medical detox for alcohol or drug addiction. If you don't know me yet, my name is Adam Vibe Gunton, founder of Recovered on Purpose, and I know firsthand how scary it can be to be addicted and dreading the withdrawal process. I've been through the withdrawals of every substance out there more times than I can count. And I've been where you are, feeling that fear, that uncertainty, and the weight of not knowing what's coming next. But here's what I need you to understand right now. Detox is not the end of the road. It's just the beginning. It's the first step toward a life of freedom, and you don't have to go through it alone. I'm here to walk you through what you can expect from medical detox as someone who has been through it and truly cares about your recovery. The process can feel overwhelming, but with the right support, it's something you can absolutely handle. I'm living proof of that. Let's dive into this topic together, and by the end of this video, you'll know exactly what to expect and why this step is so crucial on your journey to healing. First off, detox isn't just about quitting drugs or alcohol cold turkey. It's about doing it safely and giving your body the support it needs to break free from the physical grip of addiction. I've been there, trying to quit on my own, and I can tell you it's brutal. And without really good support in that time, success all the way through is dismal. Detox from some substances can even be life-threatening, so that's why medical detox is so important. When you're in a medical setting, you're surrounded by professionals who know exactly what's happening to your body and mind during this process. They're there to monitor your health, give you medications to ease the withdrawal symptoms, and ensure you're as comfortable as possible during the detox process. I know you might be afraid of what's coming. You've probably heard stories about how tough withdrawal can be and even experienced them a few times yourself. So, I'm not going to sugarcoat it. It's not easy. But I can promise you this, going through detox in a medical environment is a whole lot safer and a whole lot more manageable than trying to do it on your own. Alcohol and benzos can cause seizures or even death if you try to quit cold turkey without medical supervision. That's why you need to be in a place where they can give you the right medications and keep you safe during the entire process. So as hard as it might feel, choosing to go through medical detox is the first courageous step toward a life that's free from the chains of addiction, and that step has to be done the right way. All right, so you've made the decision to go through medical detox, and I want to walk you through the admission process. When you first reach out to a detox center, they're going to ask you some specific questions. It might feel personal, but it's important that you're honest because this is how they figure out the best way to help you. They'll ask about certain substances you've been using, how long you've been using them, and about how much. They'll also want to know about your other health conditions you might have, whether you've gone through detox before, and if you've experienced any withdrawal symptoms in the past. They're not trying to judge you. They need this information to keep you safe and give you the right treatment. The more they know, the better they can prepare for what your detox experience will look like. Once you've gone through that initial consultation, you'll go through a more detailed intake process at the center where they'll do some medical tests like blood work or a urine test to check your overall health. This helps them understand what's going on inside your body and catch any potential issues early on. You'll also talk with someone about your mental health. A lot of us who have struggled with addiction also deal with things like anxiety, depression, or PTSD. They're going to screen for these things so they can address both your physical withdrawal and any mental health challenges that might come up during detox. By the time you've finished the admission process, you'll have a clear detox plan for your own addiction treatment. This plan is tailored to your specific needs, and they'll let you know if you'll be receiving medication-assisted treatment, what to expect in terms of symptoms, and who will be working with you throughout the process, whether it's doctors, nurses, or counselors. Now, let's get into what detox actually feels like, and I won't lie to you, it's tough. But knowing what to expect can help you face it with a little less fear. And here's something I want you to remember. The pain, the discomfort, the emotions, it's all temporary, and this can be the last time you ever go through it. If you're detoxing from opioids, whether it's heroin, oxycodone, or fentanyl, here's what you can expect. In the first 12 to 24 hours after your last dose, you're going to start feeling the withdrawal kick in. You'll likely get hit with flu-like symptoms, runny nose, watery eyes, muscle aches, chills, and sweating. Your stomach might feel twisted up with nausea, and you could start vomiting or have a little diarrhea. It's rough. In a medical detox setting, somewhere in this window, you'll be given medication-assisted treatment to help ease these physical symptoms. Emotionally, you may feel anxiety ramp up and cravings for the drug can feel overwhelming. The peak of these symptoms usually hits around 72 hours in. But here's the thing, Medical detox can make all of this manageable. They'll give you those medications that can ease the cravings and reduce the worst of the symptoms. They'll help you through it 1 hour at a time. Now, if you're coming off benzos like Xanax, Valium, or Klonopin, this detox can be a different kind of battle. Benzos work directly on your brain, calming everything down, so when you stop, your nervous system kicks into overdrive. Anxiety goes through the roof, panic attacks, restlessness, and severe insomnia are common. Physically, you might feel shaky, dizzy, or have muscle pain. But the biggest risk here is seizures. If you try to detox from benzos cold turkey, you could be putting your life at risk. That's why medical detox is very important to consider. They'll usually taper you off slowly, reducing the dose over time to keep you safe, and they'll monitor you constantly for signs of seizures. It's a longer detox, sometimes lasting weeks, depending on how much and how long you've been using. But the medical staff will be with you every step of the way, as will I if you comment below so we can get in touch. Now for some, alcohol detox can be the most dangerous of all. If you've been drinking heavily for a long time, quitting alcohol suddenly can send your body into shock. You might start with hand tremors, sweating, nausea, and headaches. It can feel like the worst hangover of your life. But for some people, alcohol withdrawal can escalate into something called delirium tremens, or DTs. This can cause confusion, hallucinations, high fever, and in severe cases, seizures. Doctors at a medical detox center can help this with different medications to get you through the worst of it. This can keep the withdrawal process from becoming life-threatening. The physical symptoms for alcohol detox usually last 3 to 7 days, but the emotional toll, anxiety, cravings, mood swings can linger for a while. But again, it's temporary, and you won't be going through it alone. Yes, detox feels rough, but it's also the beginning of freedom. You're cleansing your body from the substances that have been controlling your life for so long. Every painful moment is a step toward healing. So, when it feels unbearable, remember why you're doing this. You're taking your life back. Now, detox is a big step, maybe the hardest one, but it's just the beginning of your recovery process. I can't stress this enough. Detox clears the substances from your body, but it doesn't fix the addiction. What happens after detox is just as important, if not more so, for your long-term recovery. So, let's talk about what comes next. Once you finish detox, the next move is getting into a treatment program. Whether you go into inpatient treatment, a partial hospitalization program, or intensive outpatient care, the goal is to give you the tools to stay clean and sober. Therapy for a while can also become a centerpiece of your recovery. Addiction isn't just about the physical side. It's about the emotions, the pain, and the habits that led you to use in the first place. Therapy is where you start to unpack all of that. This is where you can start rebuilding your mind, just like detox helped you rebuild your body. During this process, you'll also want to attend regular 12-step meetings. Whether you have been before or not, whether you believe in them or not, this is where millions of people before you have recovered, and this is where you can get around people who understand. For some, ongoing medical care may be needed. If you were using opioids or alcohol, your medication-assisted treatment might continue. If you've got any lingering health issues from your addiction, regular checkups with your doctor will be key in making sure you stay healthy. I remember my first months of recovery. I continued to go to the doctor to see my health progress, and it felt amazing considering I came into recovery 148 pounds of skin and bones that smelled bad and didn't know how to care for myself. Detox is the beginning of something greater than just getting clean. It's the start of a life where addiction no longer controls you. I know it's hard. I've been through it, but I also know what's waiting for you on the other side, and it's worth every bit of the struggle. Remember, detox clears the path for you to rebuild your life with the right support, the right treatment, and your commitment. You can do this. If you've watched this video, you've already made one of the hardest decisions, seeking help. Now it's about taking that help one day and one step at a time. This journey is possible. You're stronger than you think, and I believe in you and know you are going to be so proud of yourself on the other side of the short detox period. And until I see you again, keep living recovered on purpose. If you'd like to see some home remedies for opioid withdrawals, you can click right here. Or if you'd like to see my TEDx talk, you can click right here.